My name is Abigail. I'm the host of the Cradle to Crayon Show on Sunny 88.7 FM. Starting this February, join me on Sunny TV as I bring to you the Cradle to Crayon Show every Friday morning from 9:30 to 10 a.m. I host gynecologists, pediatricians, pediatric nurses, clinical psychologists, midwives, speech therapists, and so many as we discuss on issues pertaining to women and children, even the family inclusive. Don't forget, it's a Cradle to Crayon Show right here on Sunny TV every Friday morning from 9:30 to 10, and a repeat broadcast on Saturdays from 9:30 to 10. We'll talk on issues that you want to hear about your children and issues on women. Stay tuned. Morning is a Cradle to Crayon Show right here on Sunny 88.7 FM. We say thank you to our sponsors, Back Specialists Hospital and Fertility Center, Yashak, and also Rohi Children's Clinic. Because of the show, opening our phone lines will be interactive. Also, we are live on our Facebook page. You can join in the discussion. Now, this morning, I have here a doctor from the Clinical Care Unit National AIDS and STI program. Over the years, HIV/AIDS has been something on the increase. There's been a lot of talk, a lot of interventions that have gone on. So for this time, we are here to talk about a new intervention, something they are trying to roll out to curb the transmission as much as possible. So pick a break and we'll come back, we'll continue. We're going to talk about triple elimination of mother-to-child transmission. That's looking at syphilis, HIV, and also hepatitis B. We'll be back.
Hello, mommy, daddies, kids. You are all welcome to Yashak Collection. Yashak Collection, we're doing all kinds of career costume, character costume, continental costume, and Santa Claus dresses for kids. We also have kids' career costumes for doctors, lawyers, soldiers, pilots, police, firefighters, fire service, immigration and custom, suits, and many more. We also have accessories for all career. We also do wholesaling and retailing of graduation gowns and school cadet uniform. We are located at Carnation, close to Church of Pentecost, Central Assembly, Kaswa branch at the High Tension on the Bodrasi Road, and Kumasi Ejisu branch at NTK Plaza, Ejisu Zongo Junction. Call us on 0249 158 087 or 050 404 0443.
Yashak Collections.
One in town.
Yashak Collections.
All the best. Bye.
Okay, be honest. Ever wake up in the middle of the night in a mystery paddle as a kid? And if you had a sibling next to you, I'm sure you rolled them right into it and paid innocence, right? Bedwetting is normal after the age of 7. But if it continues beyond 7, or stops and starts again, or the urine comes with pain or weird colors like, say, blood or color-like, or if the kid is extra thirsty, then it's time to go see a doctor. And parents, no shame or blame game here. No punishments. Bedwetting isn't their fault. For all you know, it could be a medical condition. Let's show the kids some love.
Yes, welcome back to the Cradle to Crayon Show. We say thank you to our sponsor, Rohi Children's Clinic. Now, at Rohi Children's Clinic, children receive more than treatment. They receive full attention in the caring atmosphere. Their services include specialized care for disease of babies, children, and adolescents. There's well child clinic, laboratory services, health screening, school health services for new entrants, and also for continuing students. They are ready to serve you from Monday to Friday, from 8 a.m. to 7 p.m. And on Saturdays, they're open till 2 p.m. Locate Rohi Children's Clinic at Ridge Junction, Adenta, or call them on 0200 342 960 or 0592 053 234. Their website is www.rohicc.com. Rohi Children's Clinic, experience total care. Now, as the Christmas is getting nearer, I'm sure there are churches planning their Christmas plays. They were playing part of Mary, Joseph, the wise men, whatever it is, a shepherd. For all the costumes you want for this Christmas, your Santa costumes, whatever it is, you just mention it. That Shack will provide it for you. They also have biblical costumes, there's animal costumes, ballet costumes and accessories, all the costumes, cartoon character, whatever it is, they can provide it. But they also do wholesaling and reselling. Look at them, they are right here in Kanishin, close to Church of Pentecost Central Assembly. In Kaswa, they are Kaswa High Tension on the Bojasi Road. And then in Kumasi, they are located at Ejuso Jonko Junction, NTK Plaza. Or call them on 0249 158 087 or 0504 040 443. Yasha Collections or the best. Now about Back Specialist Hospital and Fertility Center, your #1 center for fertility, maternal and general health concerns. Their services include IVF, IUI, and other fertility services. They do child health and pediatrics, women's health and gynae, obstetrics and maternity. There's internal medicine, general OPD care, inpatient care, the surgical service, that's with general surgery and also plastic surgery. They do theater service and also laboratory and ultrasound scan services. Look at them right here in Accra, they are in Taifa, or call them on 0558 862 292 or 0592 196003. Pastor Charlotte's Hospital and Fertility Center, integrity and excellence in health care. Our supply this one is 0540 130 684. We're discussing triple elimination of mother-to-child transmission. My guest is Dr. Elizabeth Ejari, which is a clinical care unit and also a national AIDS STI program. Dr. Liz, good morning.
Good morning.
Yes, it's good. So it looks like you come on annual visit.
Yes, so.
Okay, so triple elimination, this is quite new. Last year when you came, this never came up. What does it mean?
So, in as much as we want to reduce the burden of HIV, I'm sure when the latest data came out, you may have heard about it, that we have over 12,000 new infections every year. Last year, that was 2024. And so we're trying to reduce new infections of HIV. That we've been doing for a long time. And we've been doing that with a program that we call Prevention of Mother-to-Child Transmission of HIV. So it's been there. But a few years ago, WHO came up with a framework that it's not only HIV we should try and eliminate. We have to also try and eliminate hepatitis B and syphilis. And so last year, we adopted this as a country and we started getting our guidelines together. And then we started training our healthcare workers so that we'd be able to roll out elimination of HIV, syphilis and hepatitis to newborn babies.
Okay. So this is not new to, it's new to Ghana, but that's how this is not new.
It's new to the world, actually.
To the world.
Because HIV was the focus, but now we want to add syphilis and hepatitis B. And only one country in the whole world has managed to achieve the triple elimination, and that's Maldives.
Okay.
The rest, we are still trying
to achieve it.
Yes.
Okay. But my concern too is why just syphilis and then hepatitis B? Why not any other, or just concentrate on AIDS so they can also have other contingents, whatever it is for the other ones as well?
So because this is mainly transmitted, of course, you can get hepatitis B from blood transfusion, sharing of sharps and all that. But one of the modes of transmission is through unprotected sex. And the same with syphilis as well. And so if you're able to have an intervention that targets the direct transmission, then you should be able to eliminate it from newborn babies. And then eventually it will be eliminated from the population.
Okay. So that's the help it's going to give to babies and mothers?
Yes.
Okay. How does this whole thing work?
So the first thing is to test. So the entry point is testing.
For every pregnant woman.
And I think shout out to all the midwives. They are doing so well in terms of testing for hepatitis B, syphilis and HIV. It's already being done. But the thing was that we weren't really tracking. We're tracking for HIV.
So what you're saying is syphilis, hepatitis B has always been done for pregnant women?
It's always been tested for pregnant women, yes. And there's treatment also for the syphilis as well. If the woman becomes positive, there's treatment, but we don't track whether it was effective. And so when the baby is born, whether you have syphilis or not, we don't track it. But now we are actively going around to make sure that the babies don't get it. So then the mother comes, we test for HIV.
All these three are done at the same time?
So more or less,
okay.
Yes.
Because I remember HIV, which is done for every pregnancy, but I didn't know about syphilis and then hepatitis B.
So with syphilis, the test is part of the HIV test.
Okay.
So we have a kit that does both, which we call the duo kit or the combo kit. So once you take the blood and you put it on, those two results will show. So then you know your results. But for hepatitis B, it's a separate kit. We are trying, because we're doing triple elimination, we are trying to get some of the companies to be able to give us a kit that does all three tests at the same time. So with the hepatitis B, you'd have to pay for it. That's the unfortunate thing. But because we are rolling out this intervention, we're trying to make sure that the mothers can do it for free. So once you test, and for HIV, for example, if you test and you are negative, we give you prevention methods. So if you have a high-risk behavior, maybe you are a woman, a female sex worker, or you are not sure of your partner, we give you what we call the pre-exposure prophylaxis. So because you are not sure whether you may get the infection or not, we give you some medications to prevent you from getting HIV. If at some point in time, maybe you are pregnant, but then you are exposed, maybe through rape, or you've had unprotected sex with somebody who is HIV positive, we have what we call the post-exposure prophylaxis, which we can give. Of course, the condoms are there that we continue to preach. So we give you prevention methods so that you don't get HIV. But if you do have HIV, then we give you the treatment for HIV so that it brings the viral load down. There's a statement that we say U equals to U. When you take your medications very well, you become undetectable. And when you're undetectable, you are untransmissible. So you
still would have the virus. You
still would have the virus. The problem is that it will not be in your blood, but the virus will go and hide in places we call the sanctuary sites. You know, in the Bible,
safe sites.
Safe sites, yes. So they are there. They are just there. They don't do anything. They are dormant. They are just there. The problem comes when you stop taking the medication. Then they come back into the blood. So you continue to take your medication, but you will not be transmit. You can't transmit it to other people.
Your partner.
Yes. And if it's hepatitis B, if you are positive, we check to make sure that the virus is not a lot in your blood or is not replicating. If it is, we give you medications to control it so that you don't pass it on to your baby. But once your baby is born, we give you the vaccination for the baby, which is we call the at-birth dose.
Okay, and that's also new.
So the at-birth dose, it's I won't say it's new per se, because some facilities write the prescription for the mothers to buy. So the mothers will have to buy it for the baby. But now we are trying to make sure that it's part of the normal schedule, because the hepatitis B, the hepatitis B vaccination is already in a normal immunization schedule at 6, 10, and 14 weeks. It's part of it. But the at-birth dose is not.
It's not.
So we want to put it in there so that the mothers will be able to afford it.
Okay. So for this, is it done for both mothers who tested positive and for negative, for those mothers who are positive or negative?
So if you test negative, hepatitis B negative, then we will not give you the at-birth dose, but you will get the dose in the 6 weeks, 10 weeks, and 14, because it's part of it already. It's just that the literature has shown that if you give the at-birth dose, it's protective for the baby so that they do not get it, whether through breastfeeding or even as they came into the world, the blood or whatever. Then if the mother is syphilis, if you are negative, syphilis is a bacteria. So you may be negative today, but tomorrow you can become positive. Or you may treat it today. And the thing about syphilis, the test that we do for syphilis is an antibody test, which always shows positive. So you may test positive today. Yes, for most people.
Most people, so whether they have it or not, it's going to show positive.
It will always show positive. So you may test today. I'll give you your treatment, which is like a shot. Once the treatment is done, you test in a month's time, in a year's time, in 2 years' time, it may show positive again. Doesn't necessarily mean that you are positive, but just to be on the safe side, we treat you again because it's better to treat you again than to
Definitely.
risk the baby getting syphilis. So, and then when the baby is born, we observe, there are some miscarriages, you never understand why there are miscarriages. There are some stillbirths, some small weight. It could have been syphilis. So we just observe to make sure that the baby does not have congenital syphilis. If you need to test for it, you test for it, and then you manage the child.
Okay.
Yeah.
Okay. So all this is done once when she comes in for her first antenatal testing, or in the course of time before she delivers, you're going to repeat the.
So for
test.
HIV, we do it the first the booking visits, that's what they call it. We do it then, and then at 34 weeks, we repeat the test again.
Okay.
For the hepatitis, we do it at the first time, and then as I said, if you are negative, we give you the vaccination, so we don't repeat it. And for syphilis, if the woman does it the first time and we've treated, we presuppose that you are not going to do a risky behavior again. Okay,
You can never tell.
Yes, you can never tell. So we give you the prevention ways. Just because you are pregnant doesn't mean that you cannot use a condom, because condom is not just for prevention of pregnancy, it's also for STI. So if you have a risky behavior, then you need to use a condom as well. Yeah.
Okay. Now, integrating all these, the syphilis, HIV, and the hepatitis, how does it improve outcomes compared to others separate programs?
So it makes it easier to track it if it's in one program.
Okay.
So that I'm looking at and we realized that when we're doing the syphilis, when we added the syphilis to the test kits, the testing for syphilis shot up. It became at par with the HIV because we are quite aggressive with that. The midwives, as I said, they do a yeoman's job. If you look at our data, almost 99% of all pregnant women are tested for HIV. And so because of that, the syphilis also has the same, because it's the same test kit and one sample, that's it. So once we add the hepatitis as well, we know that we are going to be able to get the results for that, other than if it's a separate program, and then now we'll have to fight for the resources and all that. Once it's all in one, it makes it easier to allocate resources. When you're doing your training, you do it once to cover for everything. Yeah.
Well, it's just 12 minutes at top of that. I have here Dr. Elizabeth Ejari. She's a clinical care unit with the National AIDS or STI program. We're discussing triple elimination of mother-to-child transmission. We say thank you to our sponsors, Bath Specialist Sutherland Fertility Center, Rohi Children's Clinic, and also their Shack Collections. Our phone lines have been open. Number to call is 0540 130 684. 0540 130 684. You do that, and then my doctor here will answer you. So I want to go back on the hepatitis B, the vaccination at bed. How effective has it been?
It's very effective if it's given within 72 hours. 72 hours of
birth?
For mothers who have a chance of passing it on to their babies. So that's what we preach. But there's also what we have, the immunoglobulin.
Okay, you can continue. So
the immunoglobulin, so with vaccination, what we are doing is that we introduce like a fake virus, like using layman's term, we introduce like a fake virus into your system, so that your body says, hey, this is hepatitis, so let me produce antibodies to fight it. And so that's how come you get your immunity against it. So if the real one comes into the body, you already have antibodies against it, but that takes about 6 weeks to be able to be effective. Now, we have the immunoglobulin, which is already the antibodies that you need to fight. And so that can also be given. But as I said, literature has shown that the vaccination is also quite effective. So if you are not able to afford the immunoglobulin, you can just do the vaccination and that should be fine. The vaccination, I think, is about 30, 40 cedis per shot.
That's the one that's bed.
So unfortunately, drug companies are trying to mobilize on it, and so they add the vaccination with the immunoglobulin. So and the immunoglobulin is quite expensive, 800 to 1,000 Ghana cedis. Wow. Yes. So so usually what we tell the mothers, when you come and you test at, maybe 1 month, 2 months when you're pregnant, 3 months when you're pregnant, start saving money, so that by the time you deliver, you have the money to be able to pay. Yeah. So, but now we are trying to get these costs down by introducing the vaccine at least into the normal vaccination schedule.
Okay. Now I have this question. It says that how can a woman who is HIV pregnant, HIV positive, get pregnant and still protect her husband from getting it?
Take the medications. That's what we always preach.
Okay, you had mentioned that.
Yes. So when you are HIV positive, it does not stop you from marrying. It does not stop you from having your own baby. In fact, your husband, your children will all become negative. If and only if you take your medications religiously and meticulously and well. As I said, once you take the medications, it will bring the viral load down so much so that we will not find it in your blood. They just go into safe sites. And once they are not detectable in your blood, you cannot transmit it to your husband, you cannot transmit it to your baby. So we always say that, look, know your status. Once you know your status, test. Once you know your status, then you take your medications. And once you take your medications, you can have a normal life, like the way live a normal life. In fact, now, for those who have been on the medications for a long time, right now we are battling with NCDs, non-communicable disease, the hypertension, the diabetes, because now they are like
have to manage it.
Exactly.
To manage it.
Yeah. So we are trying to integrate management of diabetes, hypertension into because
this can be prevented.
So diabetes, hypertension is normal for the normal population. Okay. But because we were thinking HIV, the person will die early. Now they are not dying at all because now they've become like the normal population. So you can have a normal life like that. Yeah.
Okay. So we're having issues with our phone line, so we just have to do a WhatsApp message. Number again is 0540-130-684. 0540-130-684. Just drop a message and my doctor here will answer. We're not able to pick our calls today. Stigma.
Yeah.
Once the woman walks in, like she's pregnant and it's been done, how are we putting all these together?
So stigma is a big issue that we're dealing with. So there's a different forms of stigma. There's a stigma that maybe when you go to a health facility, you perceive that somebody will stigmatize against you.
Okay.
Then there's you yourself. If you're HIV positive, you think that, oh, because I'm positive, if somebody looks at me with a funny eye, it means that they are stigmatizing against me.
They're talking about me.
Yeah, exactly. If I'm laughing in my corner, I say, hey, they are laughing at me, because you think that, and then we have the ones in the facility as well, where some of the health workers do not know that some of the things that they do or say are stigmatizing. For example, auntie me which
exactly.
So that is stigmatizing. And if I was somebody living with HIV and I wasn't there, like when you say that, it's going to hurt. So one of the things that Ghana Health Services proactively doing is making sure that we train all our health workers. We started with the nurses, whereby it's part of the curriculum. We'll then move to doctors, other allied health, the pharmacists, the lab, even security. We are going to train everybody to be
security.
Yes, because you can be stigmatized right from the gate. When you're coming in, it's like, you use this door, or a cleaner will be looking at you with some eye, So we're trying to get that in all our health facilities. But then we're also trying to empower our people as well, persons living with HIV, that look, just because you have HIV doesn't mean that your life is over. You can just go out and do everything that you need to do. Because our prevalence is quite low, 1.49. So we say that roughly around 100 people
who test. Ghana here?
Yes. Around 100 people who test, about 2, because you can't have 0.49 people, about 2 will be positive. It becomes very difficult. But in countries where their prevalence is like 10 out of 100 people, it's normal, because if your father is not HIV positive, you may be affected in some other way. So for them, it's normal. They just talk in like, oh, I'm going to take my medications, and it's normal for them. But in Ghana, they hide to take their medications. So we are trying to empower our persons living with HIV to be able to come out. And we're also trying to make sure that our healthcare workers understand that some of the things that they may do may be stigmatizing, and so watch how they behave.
Okay. And I'm sure once you integrated a few of them, when they are doing their testing, there's going to be a lot of questions you're asking them. Unlike when it was just HIV, you're going to go deep down, ask them personal questions. And
exactly.
I'm sure sometimes you'll not be able to tell you the truth, because when I release my information, somebody might use it against me.
Well, Well, it's, so one thing I like about working in the Ghana Health Service is like all the arms are working together. So the Family Health Division, which are mainly involved with pregnancies and pregnancy-related issues and stuff like that, they've introduced the focused antenatal care.
Okay.
So it's like me and my midwife. So everything my midwife needs to know about me, I can tell her in a safe space. Exactly. Okay. So we want that to continue. So you come in, you tell me everything that's going on in the family, you tell me everything and then I can be able to advise you or counsel you on how to continue to remain safe in all the situations. Okay. So even gender-based violence is also an issue. If the spouse is beating the wife and not paying, giving the money and stuff like that, socioeconomic issues and all that, you can be able to counsel them well to be able to help in this situation.
Okay. With the testing and then the treatments, how does it help in curbing, reducing this infection?
So once you test, then you know what to do. So if you test and you're negative, as I said, there are prevention packages for you. If you test and you are positive, then there and then we begin treatment for you so that it doesn't. So it's easier to manage things when they are small than when they are big. So preventing getting hepatitis, syphilis, HIV in a mother, it starts even before the pregnancy. And so as part of the triple elimination, some of the things that we are doing is to ensure that young girls have proper sexual reproductive health issues sorted out. We try and help with unwanted pregnancies. If don't get pregnant at all, because if you don't get pregnant, you are not likely to pass to a baby and stuff. So it starts from there. And then once you come into the system, you're pregnant, you come into the system, we catch you early and then manage you appropriately, whether you're negative or you're positive. Gone are the days where if you're negative, you're negative, go away. But
there's no
now
treatment.
That means you're negative, so there's nothing. But now we want to ensure that you remain negative. So there are packages for you as well. Then once your baby is born, then we also manage the baby before it becomes something else. What we've realized is the babies who get hepatitis, it becomes chronic in them. So they are fine up until they are 30, 35 years, and then they develop liver failure or liver cancer. And young person, you see that this person goes away. So we want to stop all that. Is it
because there's no knowledge of it? Or they are still on treatment?
No, so there's very little knowledge. If I tell you right now, as I said, the prevalence of HIV is 1.49. But the prevalence of hepatitis, even though we haven't done a nationwide survey, is over 10%. Wow. Yes. So people have hepatitis B more than HIV. But people don't know. I would like to say that if you don't know your status, go and check. If you check for hepatitis B and you don't have it, vaccinate straight away. It's the only and safest
something now
way.
That I can just walk into any facility and then ask for vaccination.
And ask for vaccination. You have to pay for it. As I said, it's about 40 cedis a shot. But 120 cedis is, if you compare it to the rest of your life, it's actually quite...
it's a one-time vaccination.
3 shots.
3 shots?
Yes, it's 3 shots. So you take one, then you wait a month, then you take the next one. Some people wait 6 months to take the last one, others a month later you take the next one.
Irrespective of your age?
Irrespective of your age, yeah. Okay. And I think there was a concern that pregnant women and vaccination for the hepatitis B, if the woman is negative, she can take it. It's safe in pregnancy, so she can take the vaccination. So you prevent yourself. With syphilis, there's no vaccination for it. There's only treatment. And then to prevent you from getting it, use a condom. So condom, it hasn't gone away. We still use it to ensure that people do not get sexually transmitted infections. Yeah.
Okay. Thank you so much. Our time is up already.
Wow.
Your final words.
So, HIV is not gone. And we want to get to a stage where we have no new infections, and we have no infections in newborn babies. Syphilis is still around, but if we manage it well, we can clear it from the system. Hepatitis B as well, we need to protect our new generations from getting hepatitis B. These are all low-hanging fruits that we can do. So the first thing, please test. Please test. test, don't refuse the test, because whether you test or not, if it's in your blood, it will affect you. And once you test it, the management, whether you are negative, there's prevention, whether you are prevention to get from getting new infections. If you are positive, there's management to ensure that you yourself, a mother, is fine, and then the baby too is also protected as well.
Okay.
Thank you.
Thank you so much. There's a quick question here from Mr. Roberts. He's saying, peace be unto you. With the situation of stigmatized, please add a church to help preach about it. Thank you. I think it's something that we all need to do. We talk about it. And then thank you so much for listening. Don't forget, same time tomorrow, there'll be a repeat broadcast on Sunny TV. Thank you to our sponsors, to all those who listened. Have a good working day and stay blessed. Bye-bye. My name is Abigail. I'm the host of the Cradle to Crayon Show on Sunny 88.7 FM. Starting this February, join me on Sunny TV as I bring to you the Cradle to Crayon Show every Friday morning from 9:30 to 10 a.m. I host gynecologists, pediatricians, pediatric nurses, clinical psychologists, midwives, speech therapists, and so many as we discuss on issues pertaining to women and children, even the family inclusive. Don't forget, it's a Cradle to Crayon Show right here on Sunny TV every Friday morning from 9:30 to 10, and a repeat broadcast on Saturdays from 9:30 to 10. We'll talk on issues that you want to hear about your children and issues on women. Stay tuned.